This is Steve Zeltzer with Workweek. I'm joined by Sandy Redding, who's Vice President of National Nurses Union, and her union is taking up a campaign to protect the nurse-patient ratio in California. And as all of you know, we're in the midst of a pandemic, a COVID crisis for people. People are dying, particularly in Los Angeles, but all over California because of COVID. And yet this ratio, which has protected nurses and patients and healthcare, is under threat. So welcome to our show. And Sandy, why don't you talk about this issue and why your union has taken up this campaign?
Well, thank you for having me. I greatly appreciate being here. And I've been a nurse for quite some time, over 36 years. So I've seen trends come and go. But this pandemic has had a significant effect, especially the surges on our state right now that we're currently facing. And it's really critical that nurses have adequate staffing and have proper PPE so that we can be there for our patients. If they continue to staff us at a crisis level during these surges, then more lives will be lost. It's very simple. We have the safe staffing ratios, and that prevents any nurse from being overloaded with patients that she can care for, including their acuity, which is how sick they are. And what hospitals want to do is waive the ratios. And they're calling off nurses in some places that are willing to come into work. They are continuing elective surgeries in some places. They have canceled travelers in other places. And all of these things are problematic for patient care. So we want to see the CDPH, the California Department of Public Health, stop the ratio waivers. We need to make sure that if nurses have the proper staffing, they can care for their patients in a safe manner. It won't take them too long between patients to see how to assess them, because patients can go downhill very rapidly, especially when they have COVID. We're seeing this often, and we want to make sure that we get those subtle changes so that we make sure that we prevent those downward spirals. And we can't do that if we are overloaded with patient acuity as well as with too many patients to care for. So we've all known that this surge was going to be coming. It's been months and months, and we knew that it was going to be coming, and the hospital should have been prepared. The fact that they're not prepared is no excuse. We really need to make sure that we have adequate staffing, because if you don't, nurses are going to be sick. They're not going to be there at the bedside when you need us, and it's just going to further perpetuate the problem. So we want to see a stop to the waiver for the ratios and adequately staff our hospitals with nurses so that the patients get the care that they deserve and that nurses aren't burnt out or quitting unnecessarily because they just can't sustain the constant attacks on our ratios and having overwhelming workloads so that the patients suffer. We're in it we're not afraid to take care of our patients. We need proper PPE. We're still reusing and extending the use of our PPE, and that causes cross-contamination. For every additional patient a nurse receives, it's a 7% increase in mortality. And with the acuity that we're seeing, when patients can't breathe, they can't wait. They can't wait for the oxygen. They can't wait for us to get the medication to ease their breathing or to ease their pain and suffering. And it's even worse because they don't have family members that are able to come in and stay, because the visitors are restricted because it's such a virulent virus, and we want to make sure that everybody stays safe. So those are some of the things that we're dealing with on the front lines right now.
And we're listening to Sandy Redding. She's with the California Nurses Association, NNU, Vice President in California. And Sandy, 72,000 healthcare workers have been contaminated in California by COVID. 260 have died. It's been a year now since the worst pandemic in 100 years. Why isn't the California Department of Public Health prepared? And why haven't they ordered these hospitals to do the necessary hiring of workers and protection so that the nurses and the patients are prepared?
I can't speak for them, Steve, but what I can say is that I speculate that they're pressured by the hospital industry. We're in a profit-driven system. We're the wealthiest country in the world. We have the most expensive health care, yet why are our outcomes worse than some of the other countries that have universal health care and their patients are well cared for? It is a challenge to take care of patients during a pandemic, but this is not new to us. We've had We had the Ebola. We had H1N1. We've suffered through the AIDS crisis. So this isn't new. It just goes to show that when you have just-in-time staffing or just-in-time ordering of supplies, you're going to run short. And it's just not a good way, it's not a good model for the healthcare industry. The model is, we need to make sure that we have the supplies that we need so that we can be prepared for things such as a pandemic and give the nurses the necessary protections that we need. You don't see firefighters going into a burning building without their necessary protection, and we should have the same protections that we require to do the job for infection control purposes, to prevent the spread, to preserve life, and to make sure that nurses have the proper protection so that we can be there for our patients instead of getting sick. There are, like you said, so many nurses that are getting sick and other healthcare workers that are getting sick, and it's just continuing to cycle because we don't have adequate personal protective equipment. It's a year into this thing. We should have had it. Previous administration the president should have invoked the Defense Production Act so that we could have had ramping up of the supplies of PPE that we need so that we could curb the spread and save more lives, protect our patients, and make sure nurses are protected at the bedside so we're there when you need us.
I know that Governor Newsom went to the dinner at the French Laundry, and one of the people who probably paid for it was a lobbyist from the hospital industry. You think that the hospital industry is really running the California Department of Public Health, and that's the reason they're allowing the hospitals to say that they're not going to enforce the nurse-patient ratio?
I think that there are many factors to consider, and I think the hospital associations are involved, and I think they're pressuring the powers that be that I think they are pressuring the powers that be in the CDPH, and I think it's also the CDC. We have multiple healthcare industries that are not doing the right thing when it comes to patient care. Ask the nurses. We're the ones on the front line, right? We're the ones that see what's happening. We're the ones that hold their hand when they take their last breath. And when you do it over and over and over again, it takes a toll. So absolutely, I think the hospital industry and the for-profit industry, and make no mistake, the not-for-profit hospitals are making a profit. So we need to just put the patients first. We need to make sure that healthcare workers come first, that we make sure that we have all of the resources in order to protect ourselves and our patients so that we can get through this pandemic and not cut corners and not have ratio waivers to save money and then lay off travelers or nurses and then not have what you need at the bedside just so that you can make a profit. It's not right.
And the government, the federal government, even the state government has provided hundreds of millions, billions of dollars to the hospitals to take care of patients in COVID. Has that money gone to patients and the staff in these hospitals? And where's that money gone?
Well, that would be a question for the hospital CEO. What we're seeing is we're having to continue to reuse masks, and N95s. We are continuing to have to reuse gowns, and it varies depending on the hospital that you work at. The point is, we are reusing and using masks, respirators, gowns, and other supplies. We shouldn't be doing that. Infection control practices and principles require that it's single use. And we've been trained that way in nursing school. We've been using those principles throughout our nursing careers, and it has curbed the spread. However, we're in a pandemic, and they continue to ration. When we're in a surge, they say we're rationing them, we're locking them up in the manager's office, you have to come and get them when you need them. By then, it's too late, because we need to make sure that we're there to take care of the patient and that we have the resources we need to do so safely. Time is up. We're not going to stand back and now let them erode our ratios that have been proven to save lives, and to protect the nurses that are at the bedside so that we can be there when you need us.
The structure of healthcare in California nationally is privately run. You have a privately run healthcare system, and this pandemic and the COVID thing has created havoc in the healthcare industry. Do you think that the lack of national healthcare and Medicare for all, has affected the treatment of COVID and the inability really to crush the virus?
Yes, I do. We have spoken with Global Nurses United. That's a group of nurses from various countries. We've come together. We've done Zoom meetings, and we've discussed these things. And the nurses in the countries with the Medicare for All single-payer system have had much better outcomes, less deaths of healthcare workers. They do have PPE, and we have seen a significant difference. And it's just a real shame that we are the wealthiest country with the most expensive healthcare, and we are not getting the outcomes that we need, and we see further spread of this. And it's because of the for-profit healthcare system that we are working in and experiencing right now.
This is also, the pandemic has brought about profiteering. The billionaires have gotten richer in the United States. Is it surprising that with this privately run healthcare system, some people are doing very well and actually making greater profits?
It's not surprising, but it's, quite frankly, an abomination. You know, people shouldn't be profiting off of sick people. People shouldn't be profiting off of healthcare. Healthcare is a human right. And we shouldn't look and see, wow, let's see, who has the ability to pay while they live and while the other person dies? It's not right. And we're not in favor of that. We want to make sure, and nurses know that. So when patients come through our doors, regardless of their ability to pay, regardless of any other factor, we take care of them to the best of our ability with the resources that we have. And we advocate for them, and we fight for the resources, and we stand up. And that's why I'm doing a program like this. And yes, I am president of the California Nurses Association and vice president of National Nurses United. And the beauty of that is we have 170,000 nurses in National Nurses United. And we are linking arms, and we are standing up together, and we are fighting for each and every one of our patients, regardless of state lines, regardless of country lines. Healthcare is a human right.
There has been a growth of nurses. I know if you're not in a union, nurses and healthcare workers are afraid in many cases to speak out. Have there been retaliation of your members who have spoken out about health and safety concerns and lack of PPE?
Yes, there have been. Fortunately, we do have a union, and we do have a process to curb retaliation. But we are asking the hospital industry to stop the pettiness when it comes to disciplining nurses, because all that does is drive them out of the field, and it creates a problem where you're losing nurses instead of gaining them. And a lot of these things, you know, it's an artificial shortage. The reason why we don't have nurses at the bedside is some of them are sick. Some of them have COVID. Some have been laid off, and oftentimes they're put on standby when they say, oh, we don't need you right now, we don't need you today, so we're going to put you on standby. When in reality, if we didn't have those ratio waivers, they would be required staffing. And it's just not right that they do those sorts of things and compromise patient care, compromise the nurse, compromise the standards. We just need the resources in order to do what we can to heal our patients.
And in the midst of this, I talked with a friend of mine who was covered, and then she got cut off by Kaiser. How can you have a situation at this point where people are being cut off from their healthcare providers in the midst of this pandemic?
Well, I find that despicable. And I don't have an answer except for we need a Medicare for All system where that wouldn't happen. We need a system where healthcare is not tied to your employer. Oftentimes, healthcare is tied to your employer, and if you lose your employment, then you lose your healthcare. That's not right. That means if you get sick, you get COVID or TB or something else, and you can't get the treatment you need, then it spreads in your community as well. And it also is debilitating to the patient, right? So we can't do the proactive and necessary treatments prior. So if somebody has blood pressure issues, that means that all they would need is to maintain their blood pressure by taking some medication. But if they don't have insurance, or if it's tied to their employer and they lose their job, they don't get their blood pressure medication, they land in the ER with a much more expensive diagnosis, such as heart attack, stroke, and then that causes additional problems down the line and rehabilitation. So, Medicare for All is the solution. That's what we believe is the solution. We've seen it in other countries, and California Nurses Association, National Nurses United has met through Global Nurses United, and we've discussed these things with nurses throughout the globe. And the issues are the same, but the outcomes are better in those places that have universal health care, Medicare for All system.
And we're speaking with Sandy Redding. So you're calling for people to tell the California Department of Public Health end waivers of safe staffing standards. And where can they sign this letter? You have a letter that you have on the website?
As far as I know, it is on www.calnurses.org. We need people to tell the California Department of Health that we need to end the waivers for staffing ratios, and we also want to make sure that we have the proper PPE and to enforce the standards that are put in place so that we can have safer care at the bedside. So yes, please, we're asking people to call the CDPH. We would greatly appreciate it, and it could save someone's life, including your own.
This is a life and death issue for the people of California and the country.
Yes, it is.
Well, thanks for joining us.
We're fighting for you. We're fighting for you.
And I know the nurses are not only fighting for us, they're dying for us. So that's a terrible thing. They're getting sick and they're dying for us. And the people of this state and the people of this country have to stand up and back the nurses and the healthcare workers for our own survival, not just your survival. So thanks for joining us on Work Week and getting your story out.
Thank you so much. Greatly appreciate it.